70 over 40. He's crashing.
So, how's your game going? Hire who you want, get this over with.
13, Cutner. I'm sorry. Go home.
Street drugs are laced with all kinds of things. An immune overreaction would explain everything.
Go find where he gets his drugs and what's in them. Put him on Dimer-Caprol for heavy metal poisoning.
Nothing like the threat of extermination that gets the idea juices flowing. Very excited to be reacting to House & Season 4 Episode 9 Games. On this channel we are reacting to all 177 House videos. This will be episode 90. Let's see if we can get the diagnosis before House does as a doctor working in London.
Hey, did you get a new guitar?
I see it.
Hey! Hey! Hey, cut it out, man! Hey!
Hey, it's 10:45. How about taking that on stage?
Who needs a guitar when even your cough makes heavy metal? Seems like our guy passed out pretty suddenly after the episode of coughing out blood. The optimist in me would say, oh, it was just a reaction to seeing some blood, he'll be fine with a bit of water, but it's taken me several years to beat that optimist with a stick and lock them in a cupboard as any good doctor would do. The new overlord pessimist now says this could be a massive lung bleed and he's passing out because he's got the circulating blood volume of a vegan mosquito. But what if a patient coughed this up in real life? The most common cause would be pneumonia or bronchitis. You see, infection in the lungs can damage the lining of the lung, which can lead to small blood vessels leaking blood. We really worry though when the infection is cleared and the coughing up blood still continues. Another red flag is a cough that is carried on for longer than 4 weeks, especially with a history of smoking. That could mean there's a tumor in the lung, irritating the airways and causing a cough. Is that what's going on with this patient? We need some more clues.
I want 2 names by Friday.
There's nothing here. Just the usual cracked heads, gunshots, false alarms.
Fatigue, anemia, blood in the stool and urine.
His blood results show booze, cocaine, amphetamines, opiates.
Wrap him up. I'll take him to go. Final case. Get it right, you're hired. Only the person holding this can treat or run tests.
You're an idiot. Either that or you've decided you can trust a smoking addict alone in a bathroom with an oxygen tank.
I have 17 points.
They started you all out on 100, and you blew up part of the building. Foreman accused me of playing games with patient care.
Do a bronchoscopy, it'll set off a laryngospasm.
I'll do an open lung biopsy instead.
Do your biopsy.
Hey! Won't let us finish prepping him for the biopsy.
Let you do anything except check that arm. He wallpapered himself with nicotine patches.
Real rebellion has a point.
Maybe purposelessness is my purpose.
This is the final challenge for our interviewees and the writing is not disappointed. House found his patient while on the prowl in the A&E cubicles, then Amber escorts him to the cubicle so he can turn his oxygen canister into a flamethrower, all while the man's touch screen looks like a nightclub cubicle menu. The name of this episode is Games and we can see why. House is keeping score of the team and the patient seems to be some kind of anarchist, except his most violent weapon is nicotine patches. On his opening chart though, it did say that he had been self-harming too, so maybe his destructive behavior stems deeper than just being disagreeable. All of this sounds like it could be part of antisocial personality disorder, but that isn't reversible and makes for a not so spicy diagnosis. Spicier House-esque causes could be metabolic like partial HPRT enzyme deficiency, infectious like herpes encephalitis, endocarditis, HIV, progressive multifocal leukoencephalopathy. If he's self-destructive with drugs and he likes a bit of rock and roll, then you know what completes the trifecta. Degenerative could be Lewy body dementia, maybe he's having hallucinations which are causing the aggressive episode. Neoplastic could be hormone-producing cancers like paraneoplastic Cushing's, a pheochromocytoma, or a tumor producing excessive testosterone. If there's one thing this man isn't short of, then it's adrenaline and testosterone. Well, that's 2 things. Inflammatory, well, autoimmune encephalitis could do this, but again would be quite rare. Toxic causes would be contaminated cigarettes with heavy metal poisoning. I mean, heavy metal poisoning would work so well for the irony factor because of the double meaning with rock and roll. I can see the witty House remark already, so my first diagnostic guess has to be heavy metal poisoning, just for the irony. Question for you smart people, what is the most common way for people to get heavy metal poisoning? Answers down below and I'll give you it at the end of the video.
It's not the patches. He's got blood clots moving through his body.
He has schistocytes, his blood smear, which means DIC is causing the clotting. What's causing the DIC?
Malaria.
Carry it with pride. Manipulative bitch. You're wanted in the loser's circle. Why do you hate drug addicts?
He's throwing his life away.
Not living in fear of every pop quiz. We were never talking about him. Why are you afraid to lose?
Mommy didn't love me enough. Daddy expected too much from me. Something. But how is my willingness to do anything to get the right answer bad for my patients? How is it bad for you?
Blood clots moving through the body? That makes my endocarditis theory more likely. If he's injecting himself with heroin, then bacteria can swim through his bloodstream all the way to those cozy heart valves where immune cells have little access. As the bacteria grows, it can form clots, which as they get older need to leave the nest to different body areas. It seems though that House is saying it's more of a blood clotting problem rather than a clot tourism problem, which we call emboli, so I'll activate my fear of commitment for that one. We also got another very interesting small insight here into what's driving Amber's hyper-competitiveness. It is interesting because to be a doctor, there are a lot of personality traits that you need to have. Competitiveness, propensity for action, delayed gratification, and to be a thinking type person. The selection criteria exams, the entire system rewards these traits, but wait a minute, isn't medicine about treating people and using empathy? The truth is that the public don't want doctors like House. In fact, it's quite frequently the opposite. So many patient complaints come from patients who were in principle treated correctly, but didn't like the way they were treated. Yet all the more naturally empathetic, primarily caring and emotionally oriented people in the selection criteria will get eliminated because they're that slight bit less academic. Is that a good thing for patients? That's a tough question to answer because the systems are like that everywhere. The systems also believe that empathy is a skill rather than a personality trait, and so we're trained to have communication skills sessions on how to show empathy. Being taught phrases like "I'm sorry to hear that" and "that must be tough" is relatively normal, even if they're not truly felt or given from the heart. Is it any surprise then that the stereotype of the busy, unempathetic doctor is so common? Maybe it's time that we reprioritize the traits and skills that make a good doctor based on the new knowledge age that we live in, where having a massive encyclopedic memory is only useful for exams and magic shows. Like, would you want Amber as your doctor or Cameron? Let us know in the comments.
So why do you want the job?
Not because I'm maximizing my service to mankind.
Where is he?
We were wondering if you'd sent the patient for any additional tests.
You lost the patient. 13? Come with me. Why do you love drug addicts?
I think there's more to him than the drugs.
Alcoholic parent, druggy youth.
Drugs are always a mask for something else. Shh. I hear him.
See, I'm feeling stronger already.
Respiration's good, pulse are solid.
We need a lot of nurses in here.
The juxtaposition the writers have used here makes this so entertaining. Amber hates drug addicts, the teen loves drug addicts. Tab doesn't care about the patient because he's destructive, then the patient is sneaking away to entertain kids with cancer. This strategy isn't just effective in entertainment though, as it's rooted in the psychological law of perceptual contrast. It's discussed extensively in the book influenced by social psychologist and best-selling author Robert Cialdini. Think about this, when the store clerk shows you a $400 suit and then shows you the top of the range $150 shoes, it doesn't seem that pricey. What if they showed you the $30 tie and then went to the shirt afterwards? The data shows that sales would be at least 20% lower. Some estate agents show you a bad value house before a good one to make the good one look better, or the college student who told her parents she fell out of a window and was pregnant and then told them she was joking and actually just failed her exam. You can see how that can minimize the blow, but the point is we may not be as subconsciously rational original as we'd like to think. Through all of this though, we have a new theory from 13, malaria. How could it cause the patient's symptoms? Well, the parasite can be different types of plasmodium that can infect the body in a chronic way by evading the immune system. The parasite can stay dormant, living in peace until it can relapse and reactivate months or even years after the original infection. This collapse does make it less likely though, so let's get some more clues.
Who would you pick?
You spend your life trying to avoid my advice. Taub and Kuttner.
It's not malaria. Blood work's negative.
But we did find the reason for the DIC. Bad blood fragments. If we can figure out how they got there.
It's mine, man. It's been sharing needles with this guy.
So DIC was nothing.
House! Respiratory failure.
Coughing up blood and the respiratory arrest are still on the table.
Chronic pulmonary embolism would explain the breathing problem and the blood coming from his lungs.
You have some peculiar masses near your heart.
Peculiar masses. Very spicy. I actually had a patient present in a very similar way. 21-year-old guy who came in with a cough for 2 weeks, had a bit of weight loss though, and some night sweats. Everyone thought this could be TB as he had spent some time in a country where it's endemic. After an x-ray of the chest, guess what they found? Peculiar masses near the heart. What was the diagnosis? Lymphoma, an abnormal growth of cells that make up the immune system. You know that what's interesting though, there is another condition that can cause a similar thing, has been mentioned in a lot of episodes and can lead to much of the patient's condition, including the psychiatric effects, sarcoidosis, which will be my second diagnostic guess. It's a complex inflammatory disease which we're not quite sure of how it gets triggered. It could be dust, mold or infection, and this guy plays in many back alley dive spots which probably have all three of those things and more. On an x-ray it has the characteristic appearance of swollen nodes at the root or hilum of the lung. You can diagnose it by taking a biopsy of part of the tissue where the masses are, and it classically shows non-caseating granulomas. This does work with some other bits of info we've gotten so far, like we know the lumbar puncture is clear and the clots he's had are related to drugs. Now, if watching these episodes is your drug, then check out the channel membership. You get early access to new videos, access to exclusive perks, and to suggest a series and episode for me to react to. The first 30 members get a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice, and we currently have 26 members with only 4 spots left, so press join now to secure your spot while it's available. I'll keep working tirelessly to make it worth your while.
What if it's a congenital defect, an anomalous vessel on his heart?
What do you want me to do?
MRA.
So the picture sucked because the patient was shaking. We want to look at his heart with our eyes.
If you don't do the surgery, the patient will die, and everyone will know that it's because you were pissed off at House for firing you.
Keep him in amber. This isn't an anomalous vessel. Look at these lymph nodes. Way too big.
70 over 40, he's crashing.
So, how's your game going? Hire who you want, get this over with.
13, Kuttner. I'm sorry. Go home.
Street drugs are laced with all kinds of things. An immune overreaction would explain everything.
Go find where he gets his drugs and what's in them. Put him on dimer-caprol for heavy metal poisoning.
Nothing like the threat of extermination that gets the idea juices flowing. Contaminated drugs are a massive problem since your average drug user doesn't exactly have a mass spectrometer sitting next to their toilet seat to test purity. One paper by Bentel and colleagues actually took 37 street samples of cocaine and found amounts of poisonous heavy metals like lead, arsenic and chromium. Interestingly, this heavy metal content varied so much that it acts almost like a fingerprint. This is some Breaking Bad stuff, as it means that authorities can track where the drugs came from simply by their metal content. Also pretty cool that I put heavy metal poisoning as my first diagnostic guess, and that's what the team are pursuing now. The dimer-caprol binds to common toxic metals like arsenic, lead or mercury and helps it to be excreted. But you know what else causes those big lymph nodes, and I'm really surprised they haven't mentioned sarcoidosis. Maybe they're leaving it for the eureka moment. Let's find out.
Competition works.
You don't regret anything.
You hate me, don't you?
The dimer-caprol isn't working, and Quid volunteers at a home for abandoned kids.
He works with abandoned kids?
Is it medically relevant?
I think so. I need a brain biopsy.
Whoa, home for abandoned kids. Having a 7-month-old and working with many kids at my day job, I can tell you there's one thing they all have in common. Infections, chickenpox, mumps, parvovirus, common cold, measles are all possible visitors to my clinic, who unfortunately keep sending messages back to my daughter. Well, not all of them. Interestingly, this patient's symptoms don't quite fit with the first 4, but if he had measles when he was younger, it could technically cause something known as subacute sclerosing panencephalitis and lead to a pretty nasty brain infection, and the collapses he had were possibly seizures, although that doesn't quite fit. Considering the biopsy and the abandoned kids, that will be my final diagnostic guess. We are locked in.
Plain old measles. Constant exposure from hanging out with Oliver. Twist in his lot.
It's clever.
If I'm right, the virus is in his brain.
If you can induce a seizure, you can have your biopsy.
We're gonna use flashing lights. Noxious stimulation. It'll irritate your brain.
I got something much more noxious. Now remind me of your influences here. Schedule an OR for the biopsy.
If you're gonna work for me, you have to be willing to be wrong. You're fired. 13, please stand. You're fired. Game over.
Well, what are you doing here?
Trying not to care. Hire a woman too. Hire 13. This was your plan all along.
What a spicy episode. I swear this 4th season is just on fire. It has more twists and turns than a slinky in a centrifuge. Also, it was measles. I can't believe I got that right at the end. I did get some pretty good clues from House though. Based on what we've seen then, Taub, Kuttner and 13 are hired, and we're not quite sure about what's going to happen to Amber. An interesting point in this episode here as well was that Wilson accidentally diagnosed one of his patients with cancer, and a few months later realized it wasn't cancer, and the patient was annoyed because he'd have to pay some agent withdrawal fees for not selling his house anymore. Wilson then offered to pay them on his behalf, and the patient ripped up the check saying he wants more. People never act as you expect them to. This episode was really good. So 8.5 out of 10 entertainment, 8.5 out of 10 accuracy, and 8 out of 10 diagnosis. Answer to our question is that the most common source of heavy metal poisoning is through water contamination. This episode doesn't make full sense though until you watch the previous one where a magician's trick goes horribly wrong.